Hello, dear friends. Myself, Dr. Siddharth Mavani. I'm consultant nephrologist and kidney transplant physician working at Ahmedabad. If I talk about my nephrology career, then I'm working with field of nephrology for last 16 years, and for last 12 years, I'm actively there in kidney transplant program. And so far, I have completed more than 550 kidney transplantations. And currently, I am holding position of Department of Head at Marengo Sims Hospital, Ahmedabad. So, what is nephrology? First, you should be knowing that nephrology is a part of kidney specialty that deals with the physician side. So, I'm a physician of kidney, and that deals with kidney failure, dialysis, and kidney transplantation, about which we are going to talk today. So, I'm going to talk if there is any kidney failure, then which kind of replacement therapy, either dialysis is better or kidney transplantation is better, that we are going to see in next 10 to 15 minutes. So before knowing about which therapy is better, we should be knowing what is actually the normal kidney functions like. So there are, as a normal lay person, our understanding is that the kidney functions as a filter. So it is not only filtration process. There are many other that we need to replace each and every of this function whenever there is a kidney failure. So first of all, yes, as you are true, filtration, kidney removes all metabolic waste products from the body like urea, creatinine, acid, potassiums, and extra amount of salt and water from the body. So that is number one function. But apart from that, there are many other functions like kidney forms hemoglobin. So our understanding is that whenever there is a hemoglobin deficiency, we need to take some iron tablet or iron containing food. But it is not true. Iron is a kind of say a mother, and if there is a father named erythropoietin, then and then there will be generation of hemoglobin. So where this erythropoietin comes from kidneys. So whenever there is a kidney failure, patient is having hemoglobin low and he requires erythropoietin from outside if he is not having functional kidneys. So one another function is erythropoietin or hemoglobin generation. Another is maintenance of volume status. So if we are dehydrated, then kidney will pass lesser amount of urine, and if we are overhydrated, then kidney will pass excess amount of urine, and that ranges from 400 ml per day to almost up to 20 liters per day. So that they are deciding. That is why they are called as of the body. Then fourth one is a bone. Every one of us, we would know that vitamin D deficiency, then there will be bone problem. This vitamin D comes from sunlight, but this is in a raw format. This is a 25 hydroxy vitamin D that goes to kidneys, and there is a 125 dihydroxylation of that vitamin D, and that is called as a final format of vitamin D that is responsible for bone health. So whenever there is a kidney failure, there will be bone damage or bone deficiency. There will be generation of metabolic bone disease. Every one of us, we know that whenever there is a kidney failure, there will be upregulation or gradation of blood pressure, that is called as uncontrolled hypertension. Why it is happening so? Because kidneys secretes certain hormones like renin and angiotensin, and that are responsible for generation of high blood pressure. So whenever there is a kidney failure, there will be hypertension. So these are all functions of the kidney, not only just filtration. So whenever there is a kidney failure, we wish to have all control of all this function, not only just removal of waste product that is being done by dialysis. So now let us compare whenever there is a kidney failure, what therapy or which therapy is better, whether it is a dialysis or kidney transplantation. So normal kidney functions 24 hours since birth. So even at the night time when we go for sleep, there will be continuous filtration process, and there is no holiday for kidneys either Saturday. So they work 24/7. That is cumulatively 168 hours per week. So whenever there is a kidney failure, we wish to replace that 168 hours per week to normalcy. So if we put a patient on dialysis or say hemodialysis, then one session of hemodialysis lasts for around 4 hours. So if I ask my patient to come 2 times in a week, then cumulatively it would be 8 hours per week. And the God has given us 168 hours per week. So naturally we are not reaching up to half. So if I ask our patient to come 3 times in a week, then it will be again only 12 hours. We cannot compare it to 168 hours per week that has been given us by the nature. On the another side, if we transplant this patient, if we put a functioning kidney inside the body, then that will work 24/7. So this naturally seeing kidney transplantation is better compared to dialysis in a natural way. What has given us, we can reach up to that. Number one. Number two is we have heard diseases like diabetes and blood pressure. So what we do for treatment of that, we take a blood pressure medication or take diabetes medication for that, and for that day we control the disease. So dialysis similarly is a control of kidney failure. It is not a cure. So if you have taken dialysis today, you will require dialysis in next 2 to 3 days, and subsequently next week, and next month, and next year also. So even after, at the end of 1 year continuous dialysis, you are not generating new kidney filters. You are just supporting your body from metabolic waste products. While at the another side, kidney transplantation is a cure. So here patient becomes normal, urine output establishes, creatinine goes below 1, and patient is free of dialysis. So dialysis stops. So cure is a cure, while dialysis is a control. So always cure is better than control. So again, transplantation is a better choice compared to dialysis. Now third point is quality of the life. So suppose hypothetically think there is a one young earning member of the family who is now diagnosed with a kidney failure, and now he's on dialysis. So he's going for dialysis to the hospital 2 or 3 times in a week. So this functional family now is hospital bound for 3 times in a week. So naturally he's going to spoil his daily wages as well as his earnings. And nobody is going to take such kind of person for lifelong kind of jobs. So he's going to lose his job. So on one side, he's losing his job. At the same time, he's spending more money. So important member of the family, now he's not earning actually instead. Another is quality of life. That is his food and water intake would be restricted. His medication intake would be restricted. His roaming across the town or across the city is restricted, because at the time of dialysis he has to be there. So he cannot easily travel. So that hampers his quality of the life. Sexual dysfunction that would appear on dialysis. So that is all quality of life that is hampered on dialysis. Now, if we put such kind of patient on kidney transplantation, then just think, now his dialysis is stopped. Now he can be a functional member. He can go to job. He can earn for himself or his medication and for his family. He can have good amount of food and liquid. He is not a hospital bound. So now he can roam around and his sexual function will be regained. So quality of life is naturally better. Quantity of life. So if we compare, if we take say 40 years gentlemen, say 40 years male who are having kidney failure for the same reason. So, and if we put 5 of them on dialysis and put 5 of them on kidney transplantation, and then if we follow them longitudinally, so after at the end of 1 year, 5 years and 10 years, who is living longer? So those who are transplanted are living longer. Why it is so? Because as we have seen, the functional kidney, that is transplanted kidney, would be removing the waste products 24/7. That is, every practically this kidney is functional, while kidney dialysis is just on the day of a particular dialysis day, and then subsequently for another 2 to 3 days there won't be any dialysis. So there will be accumulation of waste products, and that is harming the body. So overall life expectancy on dialysis would be around 5 to 7 years, while overall life expectancy on kidney transplantation would be around 12. So you can never ever compare dialysis at the same platform to the kidney transplantation. So that is the fourth point, that is quantity of life. Another important and most important point is the cost of the therapy. Now, if we put a patient on dialysis minimum say 2 times in a week, and for a month, then his monthly cost with medication and other injectables and dialysis would be around 20 to 25,000 rupees per month. So if we say take even 20,000 per month, then for 12 months it would be 2.5 lakhs of rupees per year. But at the end of this 2.5 lakh spending, you are just controlling your disease by doing dialysis. You are not curing it. So at the end of 2 years, if the person is still on dialysis, then he is cumulatively spending 5 lakh rupees. At the end of 3 years, it will be 7.5 lakh. At the end of 4 years, it would be 10 lakh rupees. So it is a never ending procedure, because here patient is just maintaining himself. It is just like going to the cinema, where you are buying a ticket, seeing the movie for 3 years and coming out, and your money are gone. While in kidney transplantation, say investigation cost of donor and recipient would be around 1 lakh rupees, and donor say transplantation package is around 6 lakh rupees. That includes 11 days stay of the patient, 6 days stay of donor, nephrologist charge, urologist charge, anesthetist charge, operation theater, ICU and room charge, and medication worth up to 1.2 lakh rupees. That is all included. So cumulative cost would be 7 lakh rupees. So if we calculate that, if the person who is on dialysis lives more than 2 years, then his cumulative cost would be higher than of kidney transplantation. And at the end of this, say 2 years, dialysis patient is just buying control of the disease, while kidney transplant patient is buying cure of the disease. So naturally, transplantation is way better than dialysis. And nowadays, every kind of kidney transplantation is available. Suppose there are certain forms of kidney transplantation. Number one is a ABO compatible transplantation, where say legal donor can give kidney to matching blood group patient. Suppose if patient is not having blood group matched donor, but they are having legal donor whose blood group is mismatched. Say like a patient is having a blood group of O and his mother is having blood group of B. Then we can treat this recipient with particular therapy, and then subsequently we can transplant B group kidney to the O group patient without any rejection or failure, and it carries very good long-term success. That is called as ABO incompatible transplantation. Then third is cadaver kidney transplantation, where patient registers himself to the local authority, and then whenever there is a cadaver, that is a brain dead donor, then they may get kidney transplantation from the matched donor group, blood group. So these are all possible ways of kidney transplantation. If we are talking about donor, particularly live donor, then we have to talk in two ways. One is they should be medically fit, and second is they should be legally allowed. So medically fit is those who are having age of more than 18 years and less than 65 years, and those who are not having diabetes. Okay, if it is not matching, even if it's not some, you can still go ahead with kidney transplantation. So this is medical aspect of donor. If we are talking about legal aspect, then in 1978, Human Organ Transplant Act was formed in India, and this act is for all India. It is not just restricted to any country, say any town or city or state. It is applied to every Indian citizen. And according to that, government has divided the donors into three categories. First category is immediate relationship, like a husband-wife, or say real brother and sister, father mother with age less than 65, and kids with age more than 18. First category. If you do not have any blood group matched donor in this, or if they are willing to give but they are having diabetes restriction, or somebody is not related, say not ready to give, can move to second category, that is cousins, chacha mama, say or uncle or auntie, maternal or paternal, and grandparents or grandfather or mother. If their age is less than 65, they can still give to the donor, to the recipient. And then subsequently comes as a unrelated or third category, where a patient is not related in any sense, and that is not allowed in India. Like a patient, say prospective donor is a monk, or if they are poor and wish to sell their kidney, or they are say near relative, or they are neighbors, so they are not allowed in India. So this is, I suppose, enough for you guys to understand about kidney transplantation and knowledge about dialysis. Thank you very much.